Hello, this is David from DN Cognitive Counseling. I must be doing something right. On the same day, I've been accused of being too conservative and too liberal. So I must be doing something right because I must be giving a balanced approach on some level where people are assuming many things about the theories and thoughts that I've been talking about. So I guess that's a good thing. It's interesting, though, is that as you try to explain to anybody that the wall goes up and they don't like to hear. And that's a problem. One of the things I really enjoy is being able to have conversations that go back and forth and people hear each other. It was interesting. This happened earlier with Chris. And again, I'm very much appreciative for that. And I hope we'll continue to write, because it's important for people to be able to express their ideas and be able to go back and forth and have a conversation, because people then grow. When you don't do that, you get what's called confirmation bias, where everything that you believe, you only hear and believe one thing, and you can't hear another point of view. And it seems that people are doing this more and more today, where people are getting more embedded. And I've seen it actually on both sides. And it's very sad because it makes it for the inability for people to actually hear one another. Tonight, I want to talk about something that is a big issue going on right now. There was sadly, if you heard what happened in Arizona, there was a teacher that died from COVID-19 doing summer school. What's interesting is that she didn't have kids in the classroom. They were Zooming with the kids in summer school, but the teachers were in the classrooms together, and somebody brought it in, and all three of the teachers that shared the classroom got COVID, and sadly one of them died. Now, whether you're pro Donald Trump or against Donald Trump, it's irrelevant for understanding the concept of what I'm going to talk about in terms of what happened today and the issues here. So I do want to preface this. I'm going to be showing an MSNBC clip and a Fox News clip talking about this similar issue, because hopefully I'll be able to show this has got nothing to do with politics, and it should have nothing to do with politics. This is really a health concern, and we really should be focusing in only on the health aspects. The sad part is things get so political that nothing can be seen straight anymore. So with that in mind, let's take a look at this.
All schools to reopen as coronavirus cases are surging across the country, while a teacher in Arizona recently died because of COVID after she went back to work. Kimberly Chavez Lopez Bird. She was just 61. She was teaching summer school in a classroom with two colleagues who are now recovering from the virus. 71% of Americans are fearing reopening schools and saying it would be a significant health risk. President Trump was asked about this Arizona tragedy and specifically school safety. Here's what he said.
What do you tell parents who look at this, who look at Arizona where a school teacher recently died teaching summer school, parents who are worried about the safety of their children in public schools?
The schools should be opened. Schools should be opened. If these kids want to go to school, you're losing a lot of lives by keeping things closed. I think there's...
As an answer, I mean, I hope that you all see, whether you're on the right or the left, that is a horrific way of approaching an answer. I understand the president has an agenda. I understand he wants things to be reopened. But the lack of empathy for the death of the teacher to express is problematic in terms of being able to connect to people. And what happens is it makes you look like you're cold and callous. Now, the nature of what he's saying is that there are other people that are going to have issues and problems because of it, and more problems because of closure, is not a false case to make. But the nature by which it's being made, it just shows a lack of caring. Or let me phrase that. There's missing empathy. This woman is dead, sadly, from a disease that she was trying to do a job, and now she's gone because of it. And how many other people are going to die if schools get reopened? We see now in California, in Texas, in Florida, and even in New York, the cases are back above 1,000 for the first time again since last week. We've had 2 days it was over 1,000 last week, then it was about 800 or 900, and now it's back over 1,000 again. We had days before that it was 400 and 500. This is a very catchy disease. This is something that kills a good amount of people. Now, what that rate is, we still do not know exactly. There's still the science of a lot of unknowns that are here. And it's very frustrating because we're dealing with a situation where we don't have all the information. So which way do we err on? Do we err on being more cautious? Do we err on possibility of more death? Do we err on the idea that whether we close down and now there is more death another way because people can't get other things they need? These are not easy answers, and I'm not going to sit here and pretend that I have yes, this is the solution and we should do it this way. I don't have all the answers, and I don't pretend to. But what I think is that we have to ask the right questions. And what happens is that when you're politically motivated one way or the other, you don't care about asking questions. You care about being right. The sad part is more people die when you just want to be right. We really have to ask, what is it here? What is the best answers? And we don't know because there's so much information and disinformation. And again, the sad part about this is the empathy that is not being expressed, sadly, for this teacher who tried to do her job, thinking that she was going to do what she can for summer school. Who knows? She may have had to pay her rent. She may have been behind on her bills. She might have felt the need to be able to work. And of course, that's going to put more pressure on people that have the inability to make income to have to go back to work. So, depending where you are financially, depending where you are in terms of your needs, whether or not you have children that need to go to work so that your children are being watched, all of these things are going to play a role in how you're going to decide what you think you're going to be safer with. But these are not easy answers.
There's a lot of politics going along. I think they think they'll do better if they can keep the schools closed in the election.
And there's the problem. It shouldn't be whether or not they think they can keep the schools closed to be better for the election. And it shouldn't be we need to open them up so I get a better turnout in the election and things go better for me. This is not a political conversation. This is a conversation about what is in the best interest. What's going to actually happen if we do one thing or the other?
There wasn't a lot of politics for these teachers. I want to bring one in. Joining us now, Jenna Martinez Inzunza. She was one of those teachers who survived coronavirus. And back with us, Dr. Kavita Patel. Jenna, first, tell us how you're feeling. How's your health?
I'm getting stronger. I'm feeling stronger today. I still have residual symptoms that I continue to battle. I understand it's probably going to take time for me to get back to feeling 100%. But I'm doing the best I can and definitely a lot better than I was weeks ago.
Tell us about your work environment. You and Kim were teaching together in the same classroom with another teacher. Were you being required to follow any of the social distancing or mask wearing protocols?
Most definitely. As you know, CDC guidelines were put out and we were meant to follow those. We were meant to follow those, but more importantly, our school went above and beyond and actually mandated them. Mandated protocol to us. So we followed those protocols. We were not allowed on campus without a mask. We had to take our temperature. We had to wear our mask, wipe everything down. We had gloves. We had staggered times that we could be on campus. And we proceeded as such.
This is a very important thing to understand. The statement here is we had masks. The majority of people that have masks today are what you'd see as surgical masks. Those are the masks that you have that are the thin ones with the two little things that go around, and they are very thin and do very little to prevent you from catching coronavirus. It does a little bit from preventing you from spreading it because your breath is held in a little bit, but it does very, very little to actually stop. The N95 masks do a much better job because what they do is they actually stop the airborne issue of corona. And it almost is definite in terms of what they're showing is that corona is airborne. So the poor teachers that are going there thinking that they're following the guidelines because they have the right PPE is not true. In the hospitals now, besides the masks, they also are using face shields because they're saying that there's a possibility of getting it through other pores in your face. Now, the nature is these poor women went to work thinking that we're following the CDC guidelines and we should be safe. Now, these were 3 women who had interactions with each other. What do you think is going to happen when we open up all the schools? Do we think that maybe that the nature of what will happen is the numbers will go up? As we're seeing right now, the death tolls in Florida and Texas starting to rise to about 120, 130 a day on average. I hope it does not go past that. I really do. But with the numbers of so many people that have gotten it over the last couple of days specifically, or the last week and a half actually, the death toll is a lagging indicator. So we're going to know a lot more in a couple of weeks. And what's sad is that people again are politicking this. And MSNBC is politicking this too, bringing up the story to try to emote sympathy. But from our standpoint, and what we need to know is what is the best interest for us, for our children, for our family members that work in the school? What's going to help to make us safer so that we don't have those types of issues? And like I said, I don't have the easy answer. I think there's a lot of things that need to be looked at. But false aspects of keeping people safe, which it's true, it's a false aspect. You go on a train on the New York City subway with one of those surgical masks and thinking, okay, I'm safe now, I'm wearing a mask. It's not true. And another thing, if you ever notice it, it drives me, a little batty to see, is that you see people put their mask and then it comes down their nose. The next thing, their nose is exposed. Guess what that mask, even if it does anything, like say 5%, 10% protection, you just lost it 0 to when you pull it down. So these are very problematic things. People take off the mask, people move the mask. There's a lot of issues that go on. So I really wanted you to see that. And then I wanted to go over another point of view.
While some of our country's biggest school districts are making this calamitous decision to remain partially closed this fall or totally closed, just online stuff, well, many private schools in those same cities and counties are going to be fully reopening. Well, that's great news for the kids fortunate enough to attend those schools, but for those stuck in the union-dominated public schools, well, it's a disaster in the making.
Well, it's a disaster for whom? If all those kids go and get the virus and it knocks out 5% of their parents, who do you think is going to be happier? The kids in the public school, the kids in the private school? See, the assumption that Miss Ingram is making is that, only the kids are going to suffer only from learning. But there's no even taking into account, well, what is the number of deaths going to be of all the people that bring home the symptoms? And plus, the rate for children dying from this is very, very low. Very low. But there are some that die from it. What's the number of children that are going to die from it? The more kids that are exposed, even if it's a low rate, you're going to have some. The question again is, what is it worth?
The New York Times reporting fall reopening plans are just another way the pandemic has widened gaps in education. Private schools were able to offer much more robust online learning last spring, and research suggests that school closures have widened achievement gaps. Now, as private schools move forward with reopening plans, it's the children who most need to attend in-person school.
I don't even know how the Times figured that out, because all regions, all standardized tests were put an end to. So I don't know how they figured out who learned what at the end and whether or not private schools did better than public schools. I don't even understand how they even got to that, because everything was shut down. So there was no tests. So without the tests, how do you know who's doing better and who learned better? Although I will say it's very possible that maybe private schools did a better job because they're paying money. I don't know of that for a fact, but just theoretically, maybe that's the case. But that would be conjecture. It wouldn't be factually based. So I'm a little bit confused how the Times came up with that. But worse is the idea of, again, the assumption is that the learning is the only consideration, considering what's going on and people's lives.
Who will tend to be the least likely to do so. So instead of putting children first, counties like LA and Fairfax County, Virginia, Montgomery County, Maryland, thank you, Maryland, with teachers' unions there pushing for school closures until these ridiculous conditions are met. Well, of course, the kids are going to be hurt the most are the families of color, who often don't have the resources that the other kids have to send their kids to a private school. Well, they would, though, if they had school choice. But the teachers' unions don't want that. Neither do the Democrats shouting Black Lives Matter. And now the people they claim to care about are going to suffer. Don't black students' lives matter as well in their education?
So here you have it, a totally political argument. Nothing to do with the facts or the other side, only the idea of pushing a political agenda, which I guess is what now news has turned into. Everybody pushing their political agenda. So nobody knows what's right anymore. Nobody even is getting the story anymore. It's a matter of whether you're on the right or you're on the left. You're going to have a different point of view. The only difference here is whether you're on the right or the left might lead you to be dead or maybe suffered. So one or the other could be problematic. But again, this shouldn't be a right-left issue. We're dealing with lives. We're dealing with trying to get people to do the best they can. And the issue is which is really the one that puts people at greater risk even in the long term.
And earlier this week, Louisiana's John Bel Edwards joined the ranks of governors mandating face masks to try to slow the spread of COVID.
It is binding, it's mandatory. Those measures that are contained in that order are necessary to protect public safety and promote the welfare of the people of Louisiana. They are firmly based on the authority that I have in Louisiana law, based on the Constitution and statutory law as well.
Now, we've already showed you how the science behind the mask mandates is shaky, and that's putting it charitably. But what about the legality of these orders? Joining me now.
Now, again, what's important here is just to understand this. The issue of the mask, again, is what type of mask. And as I mentioned to you about the teachers and what happened, depending on what they were wearing, it was giving them very little protection. And that's what's very sad about this. We don't have the N95 mask for everybody. When you want to go on Amazon and buy the N95, you can't. So if you didn't have it beforehand, you don't have them now. And the nature of this is that people can't get their needs met to be able to even do this. Not to mention if they even were wearing it properly. So you start to see again all of these issues in reference to politicizing a health crisis. So what could happen? What is like a potential for something? So I figured I'd bring up what happened in Missouri as maybe a test case to talk about it. As you're going to see, in Missouri, they tested all the kids. They made sure they were all tested for temperature and that nobody had any symptoms. And then...
Outbreak at Sleepaway Camp. Camp Canico, a Christian camp near Branson, Missouri, was shut down today after 82 campers and counselors tested positive for COVID-19.
There's screaming, there's shouting, there's dancing, we're having fun.
This promotional video from last year shows hundreds of kids crowded together for group activities. Now they've all been sent home, with parents receiving this alarming email. We recommend that you consider a 14-day self-quarantine for your child and monitor for symptoms of COVID-19.
Now, first of all, they showed you that promotional video from the year before and the people acting that way. We don't know if the camp even were allowing the kids to be able to be that encroached in small areas. So I think the person that shot this again had an agenda, which I don't like, but this is what we have and this is what you have to deal with. But you see, the fact is that this camp, by the way, people had money to send their kids to sleepaway camp, and it's a private camp, a Christian one. So the issue was nothing to do with whether or not they were poor, whether or not they were from middle class. This is a wealthy place to go to. And you see that money is not the issue here. It's not a rich or poor issue. It's not a white or black issue. It's not a matter of whether or not you have a political agenda. These campers want to do something fun. None of them, well, we'll get to in a second, none of them had any symptoms.
Sisters Delaney and Lauren Warner attended the camp just before the outbreak. Their dad, Graham, says the camp took every precaution.
They had doctors and nurses that were going to be staffing in case of outbreaks or any other injuries. They had protocols in place for social distancing.
These images show staff members taking the campers' temperatures as they checked in on the first day of camp.
I'm not sure what else they could have done.
Health officials in Tulsa are also reporting a surge in COVID-19 cases.
And the answer is they couldn't have done anything. This disease travels strongly asymptomatically. We're seeing that over and over again. 82 cases in a sleepaway camp. Everybody was tested before to make sure no symptoms, no fever, no problem. Yes, problem. This is one of the reasons why social distancing becomes a big issue. And even when you follow the protocol, it's very difficult to actually follow it correctly, especially with children. Now, what happens when you put this in the New York State public school system? I think the issue again is, and again, I'm going to reiterate, I don't have all the answers. But sadly, nobody's asking the right questions. It's political. And when we're politicizing health issues like this, we're all in much greater danger.
Blaming it partly on President Trump's June 20th political rally and the protests surrounding it. The news coming as the president prepares for his next rally in New Hampshire this weekend. This time, it'll be outdoors. Still, the state's governor says he's not going, and he's a Republican.
I will not be in the crowd of thousands of people. I'm not going to put myself in the middle of a crowd of thousands of people. As the governor, I try to be extra cautious for myself and my family.
And you know, here we are at the end, really, in terms of this, because the rest of this is really irrelevant to our discussion. Think about that for a second. And the issue here again is, again, the idea is to attack Trump for having his rally. And yet, thousands of people protesting in the streets, in New York, San Francisco, Texas, I mean, all over the country. And I'm not saying that the protests emotionally weren't warranted, but we are in a health crisis. The media doesn't like to report of that as being an issue. In fact, in New York, they made it not allowed to ask whether or not they were at a protest because they didn't want any press to go to that direction. Again, political, staying away from health. That should never be the case. If protests are spreading the virus, that needs to be talked about. De Blasio did a horrific job, again, with blaming certain populations for their discretions, where he sits and rightfully, in my opinion, says, don't do that, it's dangerous. But then when the protests were going on, he was like, but you have to understand their anger. Why? Everybody's got their emotions and anger and about feelings. If we're allowing feelings to be the dictation, we're going to have a lot of problems. The issue here is, what is better? And again, I don't have the right answer because I don't know. Are we going to lose more lives by reopening the schools and allowing kids to go back, bringing it home to their parents and going through their families because this thing spreads like wildfire? 82 kids in a camp where they then had to close the entire thing down with nobody being symptomatic. What's going to happen when the schools open up and the buses have to go to bring them back and forth? Then you have bus contamination, the kids in the school contamination, the kids going to the different places contamination. Even if they eat lunch at their desks and don't go to a cafeteria, they still have to get back and forth to school. and then one of the kids gives it to another kid. We have all these different issues to look at. And if we say we want to let the kids have it, then how do we protect the teachers? There are questions that need to be answered. It's not just, let's just open the schools. I think that we have to get out of thinking about things on right and left and think about what's best for all in a legitimate, objective way. What is best for all? And like I said, I don't have the easy answer, because by children staying home, not socializing, there are detriments to that too. But how much? And it really is a cost-benefit analysis. The truth is that an actuary should be sitting down and trying to figure this out, or a group of actuaries should be sitting and trying to figure this out, because it's a very complex issue. By the way, for those of you who don't know, actuaries are the ones that make your car insurance rates and prices. They figure out what are the numbers of the potentials for all of these things, and they mitigate it for risk. And so far they do pretty good, because those insurance companies make a lot of money. So your insurance that you pay keeps them under their role. So we should probably get that formula, the way they make those decisions, should probably be put to this as well. But you don't hear anybody saying that. What you hear are right and left, emotion and saying no, and all these types of things. And it's just not helpful. Again, I want to thank everybody else who subscribed. Again, I'm very honored. I want to say that if you like the video, hit like. If you disagree with anything I said, please tell me. I'd love to hear it. Just because I have an opinion or a thought process on something doesn't mean I'm right. I'll always be open to the idea that maybe I'm not. But what I will not just accept is you telling me I'm wrong just because I'm wrong. You're wrong because I said so. And then what's worse is that you don't give an argument. What you just state is you're wrong, and if you don't agree with me, you're not listening. No, I'll listen. I'll listen to what you have to say. But say something. And again, if you didn't like the video, please tell me. And of course, you can leave a comment below. I'd love to hear it. And if you'd like to subscribe, I'm subscribed, you said that. If you'd like to become a patron to this channel, just go to the link below in the Subscribe-star link. And I thank you very much. Have a good night. Have good mental health. And please, stay safe from this.